Let's talk about sperm counts and sperm quality. Yeah, let me adjust the sound. Sperm count and sperm quality is the gist tonight, right? If you're just joining, make sure you are engaging, tap on your screen and share the live. Right? Thank you for the follow. I'll follow you back as soon as possible. All right. You know that many couples, when they go for these tests, especially semen analysis, actually, right, and they hear that figure with respect to sperm count, that number during that when they get their test, so they just automatically assume it tells the whole story, right? When you hear that sperm count is above the the lower limit, say, nothing is wrong with me, I'm normal, and you're just happy, right? It's not out of place, but you need to understand that when the numbers looks high, one of the things it does to you, it means that everyone gets to relax. Come on, nothing is wrong, so let's just relax and see what happens. Now, when it looks low, people begin to panic, right? Begins to panic, and they go everywhere, even all the unnecessary places they will go. But understand from the things we've been saying all this time, right? Male fertility is more complex than that singular number that they gave you in your semen analysis, right? So when you understand the difference between sperm count and sperm quality, it will turn out to be one of the most important concepts, right, that we ever come across in reproductive medicine. Because a man can have millions of sperm and still struggle with infertility, right? Still struggle with infertility, even with millions of sperm. While on the other hand, some men with modest count can still achieve natural conception. So why is the story different? Why is the story not the same when the figures are above average? And for us to be able to appreciate this difference, we need to look at what semen analysis actually measures, right? What it actually measures and what it cannot measure. Because it cannot measure everything, right? So who is ready for this gist night? I hope. Good evening. I can't see my screen. I have something popping up, blocking off the comment section. So, hello, if you're here, I see you. I cannot see you. I cannot greet you today. Is that okay? If you're here, please comment in the comment section. I'm here. Let's be sure you are there, right? And of course, I said, did you miss the precious sperm gist? If you miss the precious sperm gist, go to YouTube now. It's there. you wanna be sure what precious sperm is and how to produce precious sperm. Is that okay? So you can go and check it out. Go and check it out. Go and check it out. It will answer a lot of questions. All right, let's go back to today's gist. First, sperm count simply refers to how many sperm cells are present in one meal of semen, right? So when you take a meal of semen, the amount of sperm cells inside is what we refer to as sperm count. Yeah. Now, I told you before that the World Health Organization has set a standard to that. No, sperm count is not just one figure; it's actually a range, right? And the World Health Organization has set the lower reference limit for sperm concentration to be about 15 million sperm per mil. So when you take the semen, take 1 mil of semen, you should have 15 million cells in that one as the lower limit. Anything less than that, you're dealing with low sperm count, right? Now, that total sperm count in the entire ejaculate. Now, normally a man should be ejaculating anything 1.5 mils and above, right? So when you take the whole thing he ejaculated, remember what was examined was just 1 mils. So when you take the whole thing he ejaculated, the amount of cells that we expect to be inside there should not be less than 39 million cells. Is that clear up until this point? You don't miss me. Don't miss me. So that I don't come and be asking questions. Anyway, ask questions. At least you'll pay for it. Right? So from typical numbering perspective, it will look like that number is very enormous, right? But fertilization is not all about a crowd event, right? Before we used to think that if you know plenty, fertilization will take place. Yeah, that's true, but because of the several events we've explained before. But in the millions that will be ejaculated, only one cell is ultimately expected to fertilize the egg. Only one. So why do we need 39 million? Why do we need 15 million in one meal? Now that is the thing. It is actually because of the challenges that sperm must go through to survive in the uterine tract. It's a long journey of hurdles, the long journey of capture and destruction of sperm. Is a difficult journey inside the female reproductive tract, right? So the way men hustle in real life, that's how they hustle as sperm. Life no balance at all. Right? So difficult journey, because when they get to the vagina there is problem, when they get to the cervix there is problem, when they get to the uterine tract there is problem. Now they get to the fallopian tube, there's still problem there. Plus the fact that the egg is even doing shakara on top. Do you know how I got here and you're still doing shakara? Come on, man. Give us some slack. So it is this journey, difficult journey, that will explain why quality matters, not just quantity. We need the quantity, yes, but at least if we plenty go, many will fall on the way, but one will succeed. Right? That's logical. But beyond the quantity, you begin to see why quality makes sense. Right? So if you are listening to me for the first time and you are at loss, just go and listen to Precious Sperm. Then you will understand where we are going. Right? Now, when we talk about the sperm count, always remember, or rather put in at the back of your mind, the race that an athlete has to go through in a marathon race, right? Where you have many runners that will start. There are many people at the start line, right? But if most of them are not trained, because when it comes to marathon race, all manner of people come. Truly, all manner of people come. Some are not trained, some people are slow, somewhere along the journey, some get injured, right? And very few reach the finish line. Very few will reach the finish line. So that's the same way fertility works, right? A high sperm count will not guarantee that the sperm are capable of reaching and fertilizing an egg. So you can have good sperm count number, but yet you're still struggling fertility. I keep on asking the question, why? Why is this happening? Right? Why is this happening? Yeah? Why is this happening? So now let us take the thing layer by layer so that we can understand some of the concerns that may lead to good sperm counts, but you're still struggling with fertility. Who's ready for this gist? And I can't see my screen, but I know you're there. And if you miss anything at all, it will always be in YouTube, right? So the first thing we want to deal with is motility. Motility. What is motility? Motility means it refers to how well the sperm can swim, right? His ability to swim forward, right? because it's key. The tendency for sperm is to swim. What is a sperm without swimming? So for fertilization to occur, sperm must travel from the vagina through the cervix, must travel across the uterus and into the fallopian tube where the egg is waiting. Even with the waiting, you still do shakara join. Go and watch my video on the profile. I have the video, I think the title is Dance of Fertility. Dance of Fertility. Go to my profile, is there. So you have an idea of what I'm talking about. So by the time the sperm gets there, the egg is just there looking all beautiful with lipstick and long eyelashes, right? Fanning herself, right? So all those hurdles, really is a challenge, right? So this is the journey that sperm has to go through before it gets into the fallopian tube, right? And for that journey to be successful, the sperm needs strong forward movement. It must be able to push itself forward, right? So when you have a sperm that just vibrate on one place, they are moving but they are just vibrating in one place, or maybe a sperm that is sluggish, right? They may never reach the destination. Why? Because they would have been selected out of the race. They are not qualified. And that is nature's natural way of selection, selecting the best. Look at us, all fine people. How did you think we came here? It's because nature selected the finest. The finest. That's how we got here. And then among these finest, we are still going to produce some more sperm, and nature will still select the finest of the finest from the sperm. So it just keep going. Right? So that's how we got here. And now, even with the motility, by the time they give you your results and you see all that thing about motility, one of the things you will notice in the motility is now divided into two. There is the forward moving, right? What we call the efficient one, that is the progressive motility, right? Progressive, that's what you see. And there is the non-progressive motility. From the name, you already know what that is. Non-progressive will mean you are moving, but you are not advancing effectively, right? You're just slow, sluggish, you're just there. So a sperm sample can have millions of sperm But if a small percentage of that sperm, right, move or swing properly, the possibility of fertilization will drop dramatically, because we need a lot of them to be progressive, to be moving forward, right? So you cannot have millions of sperm that meet the normal count, and only few are actually moving forward. Is that Aibo? Aibo is here. All right. Thank you. So even among those that are moving forward, there are those that are sluggish. There are those that are moving, but they are not moving forward. So what does the biology? It removes, selects out. Hey, Aibo, good to see you. Hawa Akua Otiwa, I see you. You're welcome. All right. So nature will remove sluggish sperm. Nature will remove wandering sperm. Those ones that are not going anywhere, they are just all over the place. Nature have a way to take it out. If Dara is here, nature takes out all those sperm that is not ready to move forward. Then only the active, progressive, agile ones will get there. So the next time you look at yourself in the mirror, just know that you were formed by that sperm that was moving forward, right? So don't give up in life, right? Don't give up in life. Nobody's coming to save you. Keep moving forward like the sperm that produces you. All right. So that is for motility. That's for motility. The next thing, look at morphology, right? There is another essential component of sperm quality. Now, next time you hear sperm quality, these are the things that forms sperm quality, right? And another essential component of sperm quality is morphology. And now morphology means shape and structure of sperm cell, right? It must have the right structure, it must have the right shape. And what does a normal sperm cell look like anyway? A normal sperm cell has oval head. The head is oval, like the egg you have, right? Like the chicken egg. Is that okay? So it's oval. It has oval head, and after the head, what you call neck, there's something there, right? Then a long tail. Is that okay? Now, abnormal. When you say this sperm is abnormal in morphology, it means it either has double head, bent tail, or irregular shape. So when we look at the microscope, we see these things and we begin to wonder how many of them are like this. Because nature will not compromise standard. Sperm must not have two heads. Sperm must not have round head. It has to be oval. Right? It has to be oval. Sperm must not have pin head. It must not be bent like this. All manner of shapes you will see. Right? And now, this structural abnormality would prevent the sperm from penetrating the outer layer of the egg. Now, just imagine a sperm that is like this, swimming towards the egg. If now maybe the egg, I go dodge them, right? Right? That abnormal structure will not allow it to be able to penetrate the egg. It won't. It won't. That's why we look at these things in the lab and identify them using strict criteria and give you your verdict. right? And of course, in some cases, only a small percentage of sperm will appear perfectly normal, even in men that are fertile. Even in men that are fertile, right? So, beyond these visible features, right, we'll go into something even more important. So, the first one we talked about was what? Motility. The next one we talk about is morphology, that's the shape. Let's go into something even more important, and that is DNA integrity. DNA integrity. You know that inside that oval head of sperm, inside that head, you have DNA material partly fitted into it. And all that material, genetic material that is packed inside, all it contains half of what is required to form a human being. You see how precious sperm can be. So don't play now. If you're a man, you have precious sperm. God bless you. You are doing well. All right. If you don't know what precious sperm is, go to YouTube. The video is there, right? And how to produce precious sperm, right? So I was saying that inside that oval head of a sperm, half of all the genetic material that is necessary for forming a human being is packed in there. Now, if that DNA that is all packed up, packaged in that head, is fragmented, or is that Sumi Love? Sumi Love is here. You're welcome in, Sumi Love. Welcome. Mwah! You're welcome in. God bless you. All right, where was I? So I was saying that if that DNA in the sperm is fragmented or damaged, fertilization may fail. Fertilization may fail. Fertilization may fail. Yeah. So it's not that sperm count is normal. Therefore, you don't have any problem. Calm down. Understand what is going on. Right? Because if there is fragmentation, if there is damage, you know what that means? Poor quality. And what happens? Embryo development will be impaired. It will stop the development of embryo. And now these are one of the many reasons of early pregnancy loss. Yeah, early pregnancy loss. These are one of the many reasons. So you want to be smart, right? You want to be smart. So go back and learn how to produce precious sperm. But again, these concepts of damaged or fragmented DNA is actually not what you see on your regular routine semen analysis. You don't see that, right? So even though it's normal, you don't see. You have a normal report. You will not see that. But yet you can still have compromised genetic quality in sperm. In sperm. And the DNA integrity matters, right? All right, that is the third thing. The fourth thing, I'm talking about the things that make up the quality of sperm. Remember, we're talking about sperm count versus sperm quality. Yeah. So the fourth thing, I think, right, is environment and lifestyle factors. Environment and lifestyle factors influence sperm quality more than sperm count. That lifestyle behavior affects quality more than count. Anyway, What are they? Smoking, I've mentioned that before. Alcohol, excessive alcohol, obesity, chronic stress, exposure to environmental toxin, even poor sleep, right? Worst case scenario, untreated infection. All these things I just mentioned will cause problems with sperm function. All these. And one of the most common causes affecting sperm quality is all that packed in one place. All that packed in one place. So what are you going to do? Adjust your lifestyle. If you would adjust your lifestyle, all the issues with sperm will reverse. That's the thing about men. If the problem is from the man, can he be disciplined enough to adjust his lifestyle? Yes. Problem solved. Just be smart. Then there's another condition which is more of a physical cause that can affect sperm quality. That one is a varicocele. Varicocele, I mentioned the other day, is when the blood vessels that supply blood to the testes, when they are large, they become dilated, right? So it increases the temperature of the scrotum. Remember, the scrotum is not supposed to have a high temperature. That is why it's outside. Good evening, favorite vibe nurse. You're welcome. Good to see you. So the scrotum is outside the body because it's not supposed to have the same body temperature. So what are you supposed to do there? It's supposed to cool off. Cool off. That's the reason why it's there. It's not for you to grab it and cause trouble, right? It's for cooling. It's for cooling, not for destruction, right? Now, sperm, the reason Ashekuma is here. Now that cooling is necessary for sperm production, because for production of sperm to occur, temperature needs to go down slightly than the body temperature. That's like 2 to 3 degrees lesser than the body temperature. Because if the temperature is high, it can reduce sperm motility and also damage the sperm DNA. So that will mean poor quality sperm, right? You see how important this sperm vein is, and how your lifestyle can affect production of sperm, right? You know, one of the things I've noticed, interestingly, is that sperm count and sperm quality do not always decline together. Some men may maintain high sperm count despite the movement, the shape is bad, right? The count is much. How many cells? 100 and something million cells. Then you look at how many are forward moving. How many are forward moving? Few. How many looks normal? Few. Nah. Thank you very much, Sheikh Kumar. All right. So these are the things that make up quality sperm. Quality sperm. Yeah. Because two men may have the same sperm count, but their total multi-sperm count can be different dramatically depending on the level of motility. In other words, depending on their lifestyle, depending on the level of DNA damage. So it's not because the count is normal, therefore you will definitely get results. It does not work like that. All right. Now, what did we say in the other episode of precious sperm? What we say was it takes 74 days for one sperm cell to be produced and mature. So what does that mean? It means that if you would adjust your lifestyle, your nutrition, manage your stress, stop smoking, right? For 3 months plus, I can almost guarantee you 100% quality sperm. Why? Because the quality of sperm is transient. If you change the behavior, the lifestyle, it changes also, right? So you want to change your behavior for 3 months, then you're going to surely have the quality of sperm. Some people, oh God, there are some things we cannot say. Some of those drugs you are taking is just unnecessary. That's that. I'll just leave it there. I'll just leave it there. So for couples, that are trying to conceive, right? I want to give you a takeaway this night. A takeaway this night. Semen analysis number, whatever the figure is, right? You must have somebody who interprets it for you in a bigger picture, right? That you are above the 39 million cells or concentration does not necessarily mean pregnancy will happen. You'll be successful. No. Right? You have to look at the motility, you have to look at the shape, and also consider other aspects that you don't see with your eyes. But these are the areas that can cause you trouble. Fertility is influenced by both partners. Get that in your mind. So when we have done the semen analysis and take several steps forward to confirm, then we'll now look at the other issues about hormone, fallopian tube, uterus, and all these things. Right? So if you are trying to conceive, like I said always, it's teamwork. Everybody must be evaluated. Everybody must be evaluated. And if there is a sperm problem, adjust the possible cause, which is more likely lifestyle and all those things I mentioned. But if you will not, you'll just be taking drugs for nothing. But again, right? So just make sure you get evaluated. So, long story short, quality is almost more important than the count, because you can have more count and poor quality and you still don't get your result. But you can have moderate count and high quality and you are successful. It's smart. All right, let me take one or two questions. A pretty short one today because